Good afternoon, everyone, and a warm welcome to all our participants joining the exclusive live webinar presented by Onus Robotic Hospitals. I'm your host for today's session, Sai Kiran Tej. Today, we are here to discuss an important orthopedic topic: current options of managing cartilage damage. Through our webinar series, we aim to educate patients and the community about modern, minimally invasive, and evidence based treatment options available today. So we are honored to have with us Dr. Rajasekhar Pappuu, Senior Consultant Robotic Orthopedic Surgeon and Head of the Department of Trauma Surgery at Onus Robotic Hospitals. Sir, it's a privilege to have him here today to share insights on the latest technique in cartilage management.
Thank you, Sai Kiran Garu. Very happy to be here. Okay, now, shall I start?
Yes, sir. And before that, sir, throughout this session, please feel free to share your questions in the chat box. At the end of the webinar, we will take all questions and discuss them directly with the doctor to get this expert insight and recommendations. Okay, doctor, over to you. Please go ahead.
Thank you. So, good afternoon, everybody. Today's topic is cartilage repair. Many of you might be getting a knee pain, but you don't know why you are getting pain at a very young age. So, one of the most common cause for the pain is cartilage damage. So, how it happens, cartilage damage? So, actually, what is a cartilage? So cartilage, it is actually not medical explanation. It is for those for non-medical people. It is actually this today's topic is. It's only for general understanding. Cartilage is a white substance which is present at the bone ends to form the joints. Main component of the cartilage is hyaline cartilage. So how you will damage your cartilage? The most common cause is degenerative disease. So what is degenerative disease? Degenerative disease is those diseases where you keep growing. At the same time, your body puts some pressure on your joint. Because of some abnormal biomechanics, there will be some increased wear and tear in the joint cartilage.
Yes.
So that's
Yes, sir.
called friction. So because of that, your cartilage will worn out and you will have a cartilage damage. Sometimes it can be three grades: grade 1, grade 2, grade 3, grade 4. Grade 1 is very early stages. That is, you might see some fissures or some hairline cracks on it. Grade 2 is superficial damage. There will be only a burrow or a గుంటలాగా ఉంటుందన్నమాట అక్కడ. And in grade 4 is that it is almost cartilage is gone, but there is still some sort of cartilage is left there. Bone is not exposed. So grade 4 is grade where the cartilage is completely worn out and bone is exposed. The second most common cause is trauma, where after an accident you might be having a fracture intraarticular. Maybe you don't have a fracture, but you might have some pressure or an impact on your bone ends because of the accident that will cause subchondral fractures. And in due course, if you have not taken treatment, they won't heal, and that will lead to osteochondritis dissecans, like focal damage. That is only focal damage. That might be of different sizes. So how do you diagnose a cartilage damage? So if you take these x-rays of knee, and the most common places where you might damage your cartilage is hip, knee, and ankle joint.
Yes.
Elbow is very rare, but you can see there also cartilage damages, but elbow is not a weight bearing joint, so you don't very often see painful conditions bringing you to the doctor for any treatment. Mainly if you have a cartilage damage in the ankle, knee, and hip, you will definitely come to us with pain or limited function, restricted function, where we will start exploring the options why you are having pain, and we'll find out. So the most common and simplest form of treatment diagnosis is x-ray. So if you see this x-ray, knee joint x-ray, the left side is normal x-ray where the round shape of the condyle is maintained, but in here in the right side of that x-ray, it's not round, but there is a burrow over there, furrow over there. That's called cartilage damage. So if you see in this knee ankle x-ray, there is some slight uh, gas-like thing here, air bubble-like thing. That is called subchondral injury. So this also, you might twist your ankle and you might land up in cartilaginous injuries. So other mode of injury common diagnosis of cartilage injury is MRI, the most commonly used diagnostic tool, and it is the most sensitive tool in diagnosing the cartilage injuries. See, if you take left side image, you see a blackened thing there, broken with a hollow furrow over here, and you see a defect here. So that is
Yes, yes,
actually the cartilage damage. And this is APU. This is if you take sagittal sections, you see again a burrow-like thing here, and this blackened thing. The other bone is normal here, that whitish color. You do MRIs at different sequences, that is T1, T2, fat suppression, and enhanced fat suppression sequences, where you find out these lesions. So cartilage usually appears, it is water-filled structure. So in T1, T2, it appears white and black. So another mode of it is the ankle MRI, where you see this osteochondral injury in the ankle joint marked as arrow mark. So CT scan is another modality where you can diagnose the subchondral bone. How much deep is the bone injury? That can be very clearly visible on CT scan. So
yes,
if you take this CT scan of knee joint, see how much deep is the injury. But the same thing is not well appreciated in the MRI here. But here you see clearly how much it is and how large is the defect. So even if you take this ankle CT scan, you will clearly see the depth of bony injury, bony lesion. So what are the indications for cartilage repair? First thing is young adult with pain, and the lesion must be small or medium size, where it is repairable. And why young people? Because young people are not candidates for joint replacement. You can't leave the joint like that, because it will go into osteoarthritis, and you might develop joint stiffness and or joint pain. It will be a continuous thing. And what are the contraindications? Contraindications is elderly patients with multiple lesions, because of the age they develop degenerative arthritis, and they develop multiple lesions, and those lesions are very large. Maybe sometimes involve the cartilage is worn out over the whole of the condyle. So the such type of big lesions cannot be repaired with current techniques. So how to handle a cartilage repair? So the most common procedures for cartilage restoration is microfracture, drilling, abrasion arthroplasty, matrix-induced autologous chondrocyte implantation, osteochondral autograft transplantation, osteochondral allograft transplantation, cartilage groove and autograft. We are going to clearly discuss each and everything in the next slides. So microfracture. A microfracture is procedure where you drill holes into the subchondral bone, from where the bleeding comes out, and then some cartilage, some mediators are released from that fracture site drilling after drilling. So it will the cartilage will be replaced with a fibrocartilage. Fibro means that is scar tissue. So that's not as good as cartilage, but it will at least prevent the bone rubbing and give you pain relief. So this is the simplest
yes.
of all the procedures, where you don't require much bed rest after this procedure. You can start walking, and you can do your activities other than physical heavy load activities. So another candidate here is that in microfracture, it is done in low demand patients and with single small lesions only. Here you see the cartilage where it is worn out till the bone, and in the right side, extreme right side, you see where we are drilling the holes. So another method of cartilage repair is matrix-induced chondrocyte implantation. What is this? So it is a two-stage procedure. That is the biggest disadvantage, because you have to come for two surgeries. In the first surgery, we do a scopy. We take cartilage from your knee joint, scrape it out, by using these cartilage retrievers, tissue retrievers, all that. That cartilage is transferred to a container with cell attachment, that is sent to the lab, where your cartilage cells are grown, multiplied, and then they will come back to us with a membrane. They will be put on a membrane, like thin layer, and that membrane is transferred to the cartilage defect. So this is second surgery where you come to us and then we implant the cartilage back into the joint to cover the defect. See, if you see these images, B, D, it is clearly visible. B is the defect, and D is the place where we covered the defect with the membrane.
Yes, it
So this is
is.
called chondrocyte implantation. Why it is autologous? Auto means your own cartilage is taken out, grown, and then implanted there. So there are some disadvantages in this. It is not effective. It is not that effective, but sometimes cartilage might worn out or come out very easily from this thing, because sometimes it won't get attached to the subchondral bone. Another form of cartilage repair is that osteochondral autograft transplantation, OATS. This is most commonly performed and it is the best procedure compared to the first procedure. Here we take out cylindrical cartilage, bone, and cancellous bone from the non-weight bearing areas. See, if you take this knee joint here, you see this is the edges are non-weight bearing in the knee joint. So from your own knee joint, small cylinders of cartilage with subchondral bone is taken and implanted here. So it is a single stage procedure where you will come to us only for one procedure, and that is very surgery cost will be less because you are to undergo only one procedure. You will
Yes.
have a separate extractor for this where you can harvest the cartilage osteochondral grafts for cartilage with osteochondral grafts, and those are transferred to this place to the defect. So in a circular fashion, but the only disadvantage here is that these you place these cartilage as cylinders. So there is some space left between these cylinders and that will be replaced with the fibrocartilage. So that is the only disadvantage. There will be some raw areas in between these cartilages, but it is better than not having cartilage. The advantage is that it is we are transferring the whole piece as with bone and cartilage, so that will incorporate very well, and the lifespan of this procedure is very good. See here, this is cartilage osteochondral allograft transplantation is osteochondral allograft transplantation. What we do in this, we take from dead bodies or from other cartilage is harvested from the humans, maybe relatives, maybe non-relatives. That cartilage is transplanted to it. The biggest risk is disease transmission. Suppose if they are having any other diseases that can be transmitted to you, or sometimes it might not properly taken by the body, and the rate of infection is very high, and sometimes this allograft might not heal, so you might get non-union of that graft base.
Yes.
What is autocart? Autocart is minced cartilage. So what we do in this minced cartilage, so we take suppose you have a defect here in the cartilage. So this defect is edges of this defect is freshened with a shaver. You take using that shaver, you take small pieces of cartilage, that is called minced cartilage. So kima కొట్టినట్టు cartilage తీసుకొని, that cartilage is transferred, collected in a cell container receiver. That container, from that container you take that cartilage, transfer to another container where you mix it with some glue, fibrin glue, and after that that cartilage is placed in the right extreme slide where you place this cartilage into the defect area, and then you just inject some glue over it. After few hours it will get attached to it. It will it won't allow the body fluids to enter in between the cartilage. So slowly blood vessels will grow into it, and the cartilage gets incorporated into the cartilage. In sometimes the disadvantage in this procedure is it overgrows in thickness than the regular cartilage. So you might feel a bumpy feeling when you bend, and straighten your knee or hand or ankle joint, you will have as if you are going over a speed breaker. So if you do MRI, you will see the hypertrophy of this cartilage. The only thing what we can do is we can shave off that thickened cartilage and reduce its thickness, It is very good in young patients up to 55 years. We can do it. Even in large defects also, we can do this procedure. It is a latest procedure, very well accepted, but it is very costly because the retrievers, containers, they are all very costly. You don't get Indianized equipment. It is manufactured by Arthrex company from US. So their equipment always is very costly, but they are very good innovators. They have
Okay.
really revolutionized scopy and its availability to the mankind. There is one more thing what we have to discuss here. That will be the question of another topic. Next time we'll be discussing few more things in a second topic. Um, so there is another thing is cartilage glue. So you get some cartilage glue. It is also very costly. You clean the freshen the defect area and inject that glue into the. We have one more here is cartilage glue. Cartilage glue is a injection which comes. Which is injected into the raw area, and this raw area slowly it gets hardened, and then slowly it will be replaced with cartilage from the surrounding cartilage. So, but this cartilage is this glue is very costly, around 1.6 to 1.8 lakhs. For you, you have to spend more money for this thing because the cartilage glue is 1.8. Other than that, you have to add the surgical procedure, hospital stay, medication, anesthesia, surgeon fees, everything cost. It will be very costly. Like a renovation is always costlier than building a new house. The only disadvantage is God has made human beings, but He has not given us spare part shops. Even if they are available, they are not within the reach of many of our pockets. So that's the reality of today's life, because we hope that they all will become cheap in future because they are now patented products. So
Yes.
nobody can manufacture it. So when the
Yes.
patent is over, available to everybody at a cheaper rate because of competition.
Yes. Yes.
Uh,
Maybe.
more things what I want to talk, but they will be a separate topic. I want to give that as a separate topic, combination of different procedures. So that will go. Okay. Thank
Yeah.
you.
Yeah. Thank you, Dr. Rajasekhar Pappuu, sir, for that highly informative and practical session. Really, it's truly encouraging to know how advanced orthopedic and robotic methods are helping patients recover faster and move better. Okay, doctor. Now we will move on to the Q&A segment. We have received a few interesting questions from our participants. Can we go, doctor?
Yeah, sure.
Yeah. The first question is that, doctor, what are the early signs of cartilage damage that people should not ignore?
See, cartilage damages, we have meniscal, which we did not discuss here. So they all start with meniscal injuries or ligament injuries. So you will have some instabilities initially because you might have some jerk, or you might be playing. So you will have some pain in the knee joint. So pain is the only thing what makes us think about this. So you will not diagnose it. Always it is not visible on X-ray. Maybe you come to any orthopedic surgeon, you might say that you might have twisted your knee or ankle or hip or anything, but X-ray initially looks fine. They are not diagnosed on normal X-ray initially. That pain continues, and if you are having continuous pain which is not coming down, then better to go for MRI and check it. So if your pain goes down with your one visit and you are happy, then you can forget about it. But if the pain is repeatedly coming even after 2 weeks, 3 weeks, it is better to get an MRI done and see whether there is any meniscal injury or ligament injury which predisposed to the cartilage injuries.
Yeah. Okay, doctor. Thank you. And next one is that, is surgery always required for a cartilage damage, or are there any non-surgical options are there?
We can see try stem cells. That is another topic. That is a separate topic. Meniscal injuries is very big topic. That's why I did not include into this cartilage repair. Meniscus is also a cartilaginous structure in the joint, but it comes as a separate thing. So I did not talk about that meniscal injuries in this cartilage repair. I have talked only purely about cartilage at the bone ends only. So other than this, we have stem cells we can use for cartilage regenerate. It is latest therapy. Few, even I have given only to one patient. Even it is costlier, around 1.8 lakhs one injection.
Yes. Yes.
So, but there are some terms and conditions for every of this procedure because see, all these injuries happen because of some predisposing factor. So just treating this with some stem cells or some oats won't help them because you have to add some other procedures also. Sometimes we have to add osteotomies or we have to add some ligament repairs. So just because there is a instability in the joint, you damaged your cartilage. So just repairing cartilage is not sufficient in this. So we have to go for ligament repair also. So it all depends. If it is grade 2, 3, stem cells will work. But there also there are terms and conditions where if there is any deformity, varus valgus deformity, you have to compulsorily correct that varus valgus deformity and give stem cells. I have given one injection to one patient. She is very happy. But the only difference is that if you give stem cells, you will not get immediate pain relief. It will take time for the cartilage to regenerate. Maybe 3 to 6 months it will take for you to get pain relief.
Yes. 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 Yes.
Before that, you will not know whether your cartilage, your stem cell is working or not. That's the only disadvantage because people want immediate result. They have spent 1 lakh, 1.8 lakhs. Even doctor also doesn't know whether it is working or not. That's
Yes.
why
Yes.
we
Yes.
do. That's why we do cartogram. So before going ahead, if you want to do a stem cell therapy, you have to do cartogram. So cartogram is a must. There are only few centers which give very good reporting for cartogram. So that is another disadvantage because it's not done at every place where there is MRI.
Yes.
So
Yes.
that is the biggest disadvantage, and not all centers are giving proper reporting. So that is another disadvantage. So if you know that it is cartilage damage is grade 2, grade 3, stem cells will definitely work. But question is, if there is any deformity, you have to do osteotomy also. So stem cell is 1.8 lakhs. Then osteotomy also costs surgery, hospital stay. So again, I said, just know that renovation is costlier than building a new house.
Yeah.
Because you need a lot of talent to do all these things.
Exactly, doctor. Yeah, doctor. Next one is that how does robotic surgery improve precision and outcomes in cartilage repair?
Robots are not used now in cartilage repair. They're only
Okay.
used in replacements as of now.
Okay.
We don't have robots in cartilage repair.
Okay. Okay. Yeah. Okay, doctor. Last but not least, last question is that what lifestyle changes can help protect joint cartilage in the long run?
There is what lifestyle you have to lose your weight.
Yes,
You and
exactly.
I must lose our weight first.
Yes, 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 exactly, sir.
We both have to lose weight, then our cartilage will be safer.
Yeah, yeah, yeah.
That is one thing. And then
I
second
agree.
thing is maintaining fitness. Don't go and play all of a sudden at weekend because your office guys are going to play cricket.
Yes, yes,
Okay, you need to be prepared. I see many
yes,
young students coming to me with injuries because they go for SI and
yes,
constable
yes, yes, exactly.
military selection. So they want to complete 10 kilometers running in 1 month.
Yes.
Then they have to jump 8 feet in 1 month.
Hmm.
Long jump, high jump, everything they want to learn in 1 month or 2 months. So I tell them, when you know that you are applying for a constable job or a SI job, why don't you prepare yourself 2 years before only, or
Yes,
at least
yes,
1 year before and try it. But they
yes,
don't
yes,
do it.
yes.
So that's where you all people get injured. Everybody gets injured because you played it on a Sunday. It's not your regular day to play.
Yeah, I agree, doctor.
Okay.
Yeah. Thank you so much, doctor, for your valuable insights and for simplifying such a complex topic for our audience. And to everyone who
Thank
joined us today, thank you for being a part of this live webinar. Healthy joints are the foundation of an active life. Take care of them and they'll carry for you far. This is
Yeah,
your
this
host,
is, if
Sakir
anything,
Ante, signing off.
If anything happens, we are here, Curox Regenerative Joint Center, our newly established center. So we are here to help you if anything happens.
Yes, yes,
Thank
doctor.
you.
Exactly. Thank you, doctor.
Thank you.
Yeah, this is Sai Kiran Tej once again signing off. Stay safe, stay healthy. Bye.